Good morning. I hope you all are well. I'm Anne Moorhead and I'm a senior lecturer in health communication at Ulster University. This morning, I would like to present to you a brief overview of communication technologies in the area of prevention and management of obesity. The outline of this presentation includes an overview of digital technologies in the communication of obesity messages based on some of my published systematic literature reviews and followed briefly by 5 examples of some technologies to address obesity, including mobile apps, computer algorithms, chatbot, online portal, and virtual reality. All of these examples can be accessed using mobile devices. We all are aware of the obesity epidemic, and it's well documented that effective communication is important to enhance health outcomes, including within the area of obesity. I'm going to show you evidence of online technologies in communicating obesity messages using a few of my own recent research studies very briefly. As part of the Weight Care project, which I was the principal investigator funded by Safe Food, one of the sub-studies of this larger project was to explore the obesity-related communication issues for primary care and community-based health professionals. One of the components was a quantitative online survey, which was completed by 382 primary care and community-based health professionals across Northern Ireland and Republic of Ireland. It was clear from this study that health professionals view as important the need to be given information on the what and the how to communicate with their patients on obesity. This study highlights that health professionals need continued support to enable them to effectively address weight-related issues in a sensitive manner that is acceptable for their patients. One way to enhance communication is through the use of technology. A systematic literature review that I've led included 98 original research studies, found that social media brings a new dimension to healthcare as it offers a medium to be used by the public, patients, and health professionals to communicate about health issues with the possibility of potentially improving health outcomes. Social media is a powerful tool which offers collaboration between users and is a social interaction mechanism for a range of individuals. Although there are several benefits to the use of social media for health communication, the information exchange needs to be monitored for quality and reliability, and the user's confidentiality and privacy needs to be maintained. Further robust and comprehensive evaluation and review using a range of methodologies are required to establish whether social media improves health communication practice both in the short and in the long term. Another of our systematic literature review publications was on the impact of digital technologies for communicating messages on weight loss maintenance, which concluded that digital technologies have the potential to be effective communication tools for significantly aiding weight loss maintenance, especially in the short term, and that is 3 to 24 months. Further research is required into long-term effectiveness of the technology, especially more recent technologies. Technology is one method to address communication of obesity. When using online communication tools, it is useful to consider the Ream Framework. The Ream Framework: R, reach; E, effectiveness; A, adoption; I, implementation; A, and M for maintenance. R, reach the target population; effectiveness or the efficiency, the efficacy. the A, adoption of a target settings, institutions and staff, I, implementation, and that includes the consistency and the cost of delivery of the intervention, and M, maintenance of the intervention effects in individuals and settings over time. All of our research studies consider the Ream Framework, plus all studies have a theoretical framework to ensure all technological interventions are evidence-based and suitable for the target users, which were health professionals, patients, and/or the general public. First, technology. First of all, we're going to consider mobile apps. We conducted a secondary data analytic study, which we analysed data from users of mobile devices and health apps from the National Cancer Institute 2015 Health Information National Trend Survey, HINTS, which was designed to provide nationally representative estimates for health information in the United States and is publicly available on the internet. From the 3,677 total HINTS respondents, we found that the main users of health apps were individuals who were younger, had more education, reported excellent health, and had a higher income. Individuals with apps were significantly more likely to report intentions to improve fruit, vegetable consumption, physical activity, and weight loss, with 83% of individuals with apps were significantly more likely to report interventions to improve weight loss compared to 72% of non-app users. App use was concluded to be associated with intentions to change diet and physical activity and for meeting physical activity recommendations. As part of the Weight Care project, we developed an online assessment tool, which was later used as a training tool for health professionals to identify individuals with obesity. As you can see from the slide, health professionals were asked to classify body status of an individual from a range of images with information available on their gender, age, weight, and height. And this included images of adults, teenagers, and children. The results showed that there was general trend that primary care health professionals were more accurate at assessing normal weight individuals and were more accurate at assessing weight categories of adults, followed by teenagers and children. These examples show that mobile apps are useful to gather and provide information, assess skills, and train individuals. The next technology that we're going to consider is computer algorithms, predicting calories from food images. Another set of studies included developing and testing computer algorithms in predicting calories in photographs of meals. This research found that image nutritional analysis techniques discerned a more accurate calorie reading from photographs of food items. Thus, a semi-automated system can predict calories in photographs of meals. Machine learning algorithms were later used in further studies, and these machine learning algorithms can be used to classify segments of photographs of food for food logging and diverse food image databases. Computer algorithms are useful for individuals to track their food intake by providing them with more information to inform their food choices. The next technology is a chatbot. And a chatbot is a computer program designed to stimulate conversation with human users, especially over the internet. Effective communication is hindered by conflicting information and the sensitivity of obesity. Recent technological solutions for weight loss maintenance are limited. A chatbot would be appropriate for supporting weight loss, as it does not require a human operator and is available 24 hours a day and supports natural communication. This research designed and developed a chatbot, which we call the Weight Mentor, So Weight Mentor is a self-help motivational tool for weight loss maintenance. Weight loss maintenance. Weight Mentor operates within Facebook Messenger, which is currently one of the most popular social media platforms. Weight Mentor's purpose is to positively influence the user's emotions while maintaining weight loss. Its functions include self-reporting of diet and physical activity, reviewing previous self-reporting trends, and motivational messaging. Chatbots such as Weight Mentor has the potential to aid weight loss maintenance. Our usability tests confirm that chatbots are highly usable due to their simple interface and conversation-driven functionality. The next technology is an online portal. A current study, which is part of the STOP project, which is a Horizon 2020 RISE project funded by the European Commission to address the challenge of preventing obesity in Europe. This project brings together interdisciplinary and intersectional group consisting of 7 European partners listed on the slide, who are subject matter experts from industry and academia under one umbrella to address the health societal challenge of obesity. The STOP project will address this need through the foundation of an innovative platform to support persons with obesity for better nutrition under the supervision of health professionals. To date, the STOP platform has been developed that captures various persons with obesity's data from different kinds of smart sensor streams and chatbot technology, manage and enrich available data from existing knowledge bases and fuse these by machine-learned driven data fusion approaches for sophisticated artificial intelligence data analysis, as illustrated on the diagram in the diagram on the slide. Essentially, this gathered and analysed data and knowledge is accessible and usable for health professionals, amongst others, as input for a gamification approach to teach persons with obesity healthier nutrition. Now this STOP platform is developed, and it's now being developed as a mobile app with secured multi-client web-based portal integrating several machine learning-based support tools. At present, we're very excited. We are currently just started the feasibility study, and which is currently underway. And I have the privilege of leading this work package for the feasibility study and the RCT. The feasibility study will be followed by a randomized control trial, the RCT, and within a couple of months. And the RCT will determine the STOP platform's effectiveness. We have received ethical approval for the feasibility study and for the RCT, and participant recruitment has just started. So we await the exciting results from this feasibility study and the RCT. Another technology that is currently being explored for weight management is virtual reality, VR. As part of a PhD, the virtual reality training tool for health professionals is to improve weight-related communication across healthcare settings. The PhD student, Fiona Quigley, will show a demonstrating of her system immediately after me, so you will hear and see more about this exciting new development. You have now seen a few examples, very briefly, of how technology can be used to communicate messages in the prevention and management of obesity. In conclusion, technologies such as the STOP platform provides intelligent, interactive communication with users, besides access to information from a broad range of relevant knowledge bases to support decision making of health professionals. Online communication tools have the potential in obesity prevention and management, but further research is required, especially those that are theory based and have a theoretical framework and underpinned by theory. These are the references for this presentation. And I am happy to answer any questions that you may have at the panel sessions. And you're very welcome to contact me. You can see my contact details on the slide here. Thank you all for listening.